Hi, everyone. My name is Hanny Al-Samkari, and I'm a classical hematologist and clinical investigator at the Massachusetts General Hospital in Boston, as well as an associate professor of medicine at Harvard Medical School. I also co-direct the Mass General Hereditary Hemorrhagic Telangiectasia Center of Excellence, or HHT Center, where I care for many patients with HHT. What is HHT? HHT is the second most common inherited bleeding disorder. For every man with hemophilia, there's a woman and a man with HHT. And the most common outward manifestation of HHT is recurrent and often severe nosebleeds. The medical term for that is epistaxis. So, what of nosebleeds? Most of us get nosebleeds, commonly when we're children or perhaps in the dry winter months. People with HHT get nosebleeds starting in childhood, young adulthood, that progress and get worse and worse throughout life to the point that it's really limiting. It dramatically reduces quality of life. It might make it difficult or impossible to work the person's job. About 40-50% of patients with HHT will develop depression, anxiety, or even post-traumatic stress disorder just from nosebleeds. Can you imagine that? So the amount of nosebleeding that my patients and patients with HHT have to deal with, we're not talking about a 5-minute nosebleed, once a week or something like this. We're talking about, very commonly, multiple nosebleeds a day, sometimes lasting in total an hour to 2 hours, 3 hours. So, HHT, to be clear, is much more than a disease of nosebleeds, but the most common thing, the most common outward manifestation that people have to deal with HHT are the nosebleeds. And if it was just a disease of nosebleeds, it would be terrible. But there's actually so much more to this disease that really cause problems for patients that, are limiting in terms of life, quality of life, survival, and really serious, complications of the disease. But we can't forget, right? Could you do your job? Could you live your life? Could you have a social life if your nose bled unpredictably for 1 or 2 or 3 hours a day, right? That's what patients with HHT have to deal with. For more information on HHT and everything related to it, visit curehht.org.